The following video is the opinion of Danton S. Dungy, MD. It is not medical advice. It is a tool that he is providing for his current and future patients. It is meant to serve as a review of the common concerns brought to Dr. Dungy's attention over the years. This video is not designed to diagnose, cure, or recommend treatment for any medical problem, nor is the video all-inclusive of the medical opinions of other surgeons. Equally, the opinion expressed in this video may not be relevant to your specific condition. Dr. Dungy is giving a general overview and would recommend that you schedule an appointment if you would like further information. For additional contact information, visit his website at dungymd.com.
Hello, Dr. Dungy here from the Dungy Orthopedic Center. This video short is about the treatment options available for hip arthritis. As a surgeon, I'm often asked what patients can do to help relieve their symptoms regarding hip pain secondary to arthritis. Unfortunately, there are not many options available. The first one I recommend is weight loss if overweight. By losing weight, you'll put less pressure across your arthritic joint, and this will make you feel better. Patients often tell me they cannot exercise because of pain, and therefore they have a difficult time losing weight. Make no mistake about it, exercise is important because it can strengthen your muscles and is good for your heart and lungs, and I understand that pain can prevent you from exercising. But when it comes to weight loss, the reality of the situation is that caloric intake is the most important thing you can watch to make sure you can work on weight loss effectively. This may require the supervision of a physician. If weight loss doesn't or does not occur easily, then the next thing you should consider is taking weight off your joint by using something like an assistive device. This includes walkers, canes, or crutches. Many patients think they're too vain or too young for such a device, but it can buy you some time before you have to consider surgery. The next option would be medication. Over the counter, there are many medications that can help patients with arthritic hip pain. These include standard anti-inflammatories such as ibuprofen. This comes packaged in familiar formulas you may have heard of, such as Motrin or Advil. Aleve is another anti-inflammatory available. These medications work very well at decreasing your symptoms of pain. However, there are side effects with these, just as any other medication. The most common ones are decreased kidney function with prolonged utilization. Therefore, your doctor should check your kidney function on a regular basis. At the same time, these medications have been shown to cause an upset stomach, and sometimes it can even lead to stomach ulcers and bleeding in some patients. In an attempt to reduce this risk, doctors and pharmacists often recommend that you take this type of medication with food. If medication is no longer working for you, or you're unable to tolerate it because of allergies to aspirin or anti-inflammatories, then we have to consider physical therapy. Physical therapy is not for every patient, but sometimes strengthening the muscles around the hip and pelvic region can help decrease the weight across that joint by letting the muscles bear the weight more of the body than the arthritic bones. If physical therapy is not working for you or is not an option, then possibly injection therapy could help. Injections are best explained as an anti-inflammatory delivered right to the joint that is arthritic causing your pain. Cortisone is the most common one provided. However, not every patient is a good candidate for this type of therapy. Radiographs or x-rays would have to be obtained and reviewed with a physician to make sure you are a good candidate for possible injection therapy. Now, keep in mind, these are not an end-all be-all of the treatment options. Your symptoms will return, and none of the outlined options will regrow the cartilage that has been injured or destroyed in your hip. The last resort would be joint replacement surgery. This includes both hip replacement and/or hip resurfacing. The decision is one that is going to be ultimately left up to you as a patient to decide when it's time to do it. Your surgeon can help guide you through this process. Thank you. Be sure to visit my website for additional videos and information at dungymd.com.